politics, any campaign, any elections, no reasonable government will give you that short time to say, I will, at the end of the day, fulfill every single demand on this document. Now you understand. It is all next year, the leadership, they are misleading you. They are misleading you because our priorities, it is more political than you, what you need. And I don't have a problem with the nurses who are sitting at home, because when the leadership says, Mamu Bejuma, only why so be Juma, but at the end of the day, is it worth it? You staying at home and the opinion phobia. The reason why leadership, I'm opinion phobia, we can still fight for what we want by saving lives, because this agreement wasn't signed by this government, and the government that signed the agreement, your leadership knew they were not going to fulfill it. The government cannot fulfill this. Let's be real. We are trying to get out of the mess. Mami way any new kunu party they created. This woman and her husband's party, the mess that they created. We are all trying to get out of this mess. This woman, Nikunu political party, the mess they created. This government, it did 5 months. MPP was in power for 8 years. You people never went on strike to put everything down to allow innocent people to die. Some people are doing politics. This woman is doing politics because a Nikunu party in free power. Because they want to use you, the young ones. The government cannot. And this is the reality. Let's not play with this. Let's not act. Let us not pretend. The earlier you tell your leadership to sit and be reasonable and meet the government halfway, for the government to be able to at least fulfill some part of it. The government cannot fulfill everything, because agreement na mami we di mutikwa sha. This woman knew that her husband's party, MPP, 8 months to elections, they were not going to do this job. So more nurses for more person makoya mami when also mo strike demonstration tia na mo changing. For 8 years she could not get you these things. This is the woman I also more pamono. When also more rise against him, say I was some changing, because for 8 years, if she could not get this for you, then just 5 months or person because she's doing this because her husband's political party is out of office. That is why we are here today. That is why we are here today. I'm asking you. We are next now, basically, this woman has turned you people into murderers because of her selfish interest. But you people, deep down, you want to work, you want to help people. The negotiation that happened under MPP, they knew they were not going to fulfill it. They knew it. This woman knew it. Party, she knew what she was doing. But you see, they knew, say, more young ones now, they can play on your conscience. They can use you. That's why today people are dying. And she has left you people, oko Finland, oko preposition, young people, ekunafo enkwara, mwankasa mabusu fo ni bi ewu, all because some woman and her husband, or mwankasa junior do. It is not about the welfare of nurses, but also it's just for them to feel important in a political party. And this is the reality.
OPD for so almost so I was saying
38-year-old Zilla Okine is 9 months pregnant and battling severe stomach pain. She journeyed from Teshi to the Adabraka Polyclinic, desperately seeking medical care. But upon arrival, she met a painful reality. The facility was almost deserted. Nurses, who would have typically been the first point of contact, were nowhere to be found.
Maybe Baby by will be any honomo and I'm anti information be as we say baby say ever coso till say my baby home.
Her hopes of finding relief were dashed. Tears welled up in her eyes as the pain grew worse, with no one immediately available to help.
Fiti and run on my run is a seen so maybe no more checking, but unfortunately bedroom animal say so be any animals.
I watched her from afar, clutching her belly, pacing and occasionally sitting in discomfort. It became clear she couldn't wait any longer. I stepped in. After speaking to one of the few staff members present at the maternity ward, Zila was eventually ushered in. But that was not the end of her wait. For nearly 20 minutes, she sat quietly before being processed and directed to a consulting room where a doctor finally attended to her.
They've checked me, but they asked me to come and see the doctor. So I'm in the queue to see the doctor. I feel okay now. Yeah, I feel better now than before.
The question here is, what would have happened if no one had intervened? How many people like Zila are left in pain with no one to speak for them? This is just one of many cases playing out in health facilities across the country. The outpatient department of the Adabraka Polyclinic on a regular day is very busy. But behind me, just as you can see, the place is virtually empty. Nurses here, like many across the country, have abandoned posts as part of the ongoing strike by the Ghana Registered Nurses and Midwives Association. And the impact here is dire. Patients who would typically rely on this facility for basic health care have been left stranded with no medical staff in sight.
It will last as long as government agrees to implement our condition of service. That's it. We have withdrawal of OPD and emergency services. That is from 4th to 8th, and after 8th, that is 9th, we are withdrawing all services, including wards, theaters, and all the hospital facilities. What we are saying is we also need to be taken care of. Is it not sad what you be at the emergency and government agency, departments, and other ministries will come and government will pay for them, and you, a nurse, a midwife, will be at a hospital when you are sick, common para, you will need to pay for it.
According to them, this is the fourth major strike action by nurses and midwives in less than 6 years. Strikes were recorded in 2018, 2020, 2022, and now in 2025, all centered around unfulfilled agreements, salary arrears, and poor working conditions. In response, the Ministry of Health has issued emergency directives aimed at maintaining essential healthcare services during the strike. A high-level meeting was held earlier this week where the unions presented a unified demand for the implementation of the 2024 collective agreement, which they claim has yet to be honored. The ministry says it is closely monitoring the situation and is working to deploy logistics and support systems to minimize the disruption. But for patients like Zila Okine, the delay in care is already a heavy burden to bear. As the industrial action continues, thousands of patients are caught in the middle, waiting, hoping, and in some cases suffering. From the Adabraka Polyclinic in Accra, I am Godwin Asidiba reporting.
So these are the facts. Thank you very much to Godwin. I think it's TV3, right? Yeah. These are the facts. Your leadership, they are misleading you people. They need to renegotiate. They need to say with the government. The NPP they are not intelligent people. They did that for power. And Omenia power no. Where they put you people no. The government cannot fulfill all your demands. And your leadership, they are doing politics. And it hurts me when I see a young nurse in Ghana or say, we are nurse now, para crampono, untiminto para. No, that's why you are working. That's why you need health insurance. That's why police or you have health insurance. That's why civil servant now, sebi or tankers no, your money health insurance. I also do health insurance no. We are nurse. Menya sure say America abrochi ha nurse ni bi so hospital or yejuma hospital or yarinti or see money drew free. No. In fact, abrochi hospital be any one point drew. Why are you people making why are you coming up with these ideas? Where is it coming from? Say nurse didn't say me call hospital na me yarea na me yejuma parakura me nyebi. No, it is not for you. That is why you are paid. You have every right to demonstrate when you are not paid, because that is what you use to take care of yourself, your children, your husband, take care of your needs. Until you cannot tell me, say, with all due respect, we are nurse in or say, oh yarea, utimi para, or hospital free. No, It's not see any free yeah. And the police in now nam hona or so the TN also to be Bora hospital like I say. Me so e to de kutameno me de bo Ghana for ho ban into mama me drone fanya miti na me so me hon tome. And I say a prison officer no ono so obo prisoners ho ban sebio ye onkofo bi go prisoner o me hardened criminals, hardened armed robbers. Ye jaw mo no pia bon te o me ku yire. Ono so say me so I'm putting my life there on the line. Mo so mama me draw free. It does not work like that. It does not work like that. It's what I can tell you when they say, as much as you are sitting at home, no, I'm telling you for a fact, tell your leadership to renegotiate. Because someone renegotiate here, what is going to happen? And they say, you'll be sitting at home thinking you are hurting Ghanaians, you end up hurting yourselves. Remember, hospitals now, machines, this is no. Say, at the end of the day, say, if you're on strike, now you buy area. Unya ba no so obetima ese maami we onuso betime ewu de bia me catch government, and I've told this government about nursing in Ghana, we need to privatize it. Aban or say oyin in free employing nurses. We need to give institutions, private institutions, accredited institutions, the right to recruit for government. And they will have to be paid through these private agencies.